We're live here at HCIC in Austin, Texas.
Podcasters are today's influencers, so you included.
I'm no influencer. Being a little bit modest. He's modest, guys. You're not deliberately being a competitor. You're just better at it. We're coming to you live from HCIC, the Healthcare Internet Conference here in Austin, Texas. And I am excited to be sitting down with Selima. Here we're going to be talking about some of the challenges that our industry is facing and how we as professionals are going to rise to that occasion. Selima, thank you so much for being part of our conversation today. Would you mind sharing with our audience a little bit about you and your role?
I am Selima Khan, and I oversee teams that are responsible collectively for brand experience and brand management, for corporate communications, digital experience and marketing operations, and also corporate partnerships and wellness.
The role of marketing communications plays a really important part for any health system or any organization really in this space, because I think our goal should be about representing the voice of customer. And so let's talk first about some of those macro trends that you might think are really aligned to voice of customer and what that means to us.
I think it's well known that we've got many challenges across our communities, really, across our nation. And it's overwhelming, I think, on one hand, to think about where do you really begin to solve and find solution. And I think that it really starts by really zeroing in on your individual communities and really figuring out what are those most significant pain points and how can you solve for those. I think in some cases we're talking about access, which clearly is a major issue for many, many systems. In some cases we're talking about just overall well-being, mental health issues and crisis in those areas. Also other big areas to tackle. SDOH, all of these things that I think we're collectively trying to kind of navigate through and ultimately find solution for the people that really need our care, need our services and support.
Yeah, and what you're talking about, social determinants of health and understanding our patients and our communities, a lot of times that's something that's outside of the marketing suite. Yet I think we have an important role to play in helping to help convey some of this to the rest of our organizations, because we have the unique ability to, in some cases, keep track of things that they're talking about and saying online. You were in a panel today, you were talking about, understanding what people are talking about you online, et cetera, and how you can bring that back in. Sure. What's your perspective on that?
Yeah, so, I think that we are at a time where we have unprecedented levels of input and an opportunity to be able to listen in ways that we could have never listened before, right? And so I think that I tend to think about it across 3 or 4 areas. We've got all of the different channels as it relates to marketing communications and the things that we oversee directly. We've got our operational channels, and then we've got our clinical and financial challenges, right? When I keep saying channels,
Yeah.
Where we are garnering huge amounts of data and insight and understanding about the community that we're serving. So it's really looking at all of those collectively and figuring out how can we best curate and aggregate and analyze, synthesize that information in order to be able to have insight that we can then act upon.
It's a common statement that says, our industry is data rich but information poor, right? Or insight poor, maybe. And I think that's part of what we're getting at here is that we have I love the term unprecedented amount of data. I think it's true, we do. Right. There is a lot of data out there. But how do we synthesize it? And ultimately, as marketers, our role in part is to help synthesize and tell that story. Right. The persona development, all the things that we kind of do, right? So, from your vantage point, how do you see our unique role? How could we do that? How could we start to do that better?
There's a theme, I think, around partnering that is underrated and underestimated, right? So whether it's within your own organizations or whether it's at the community or regional level, where you are really proactively seeking out insight, input, so that you can really correct course and or find solutions together, right? I think that as an institution, we try to do a lot independently, but we can do more together. And that's as much with the community as it may even be, as we saw during COVID, where we came together as systems to be able to solve for some of the big issues that were facing us. And so we're looking at doing some of the similar things now in a similar manner.
Right. The rising tide lifts all ships,
right,
as the metaphor goes. But I think that's a really interesting part too, because not only as marketers do we advocate for the voice of customer, and we can tell stories, but we're relationship builders. I mean, that's inherent to what we do as a
Right,
discipline,
right, right.
right? And so that new partnerships with finance, with community outreach, with our clinical audiences, that's the new role of marketing in this day and age. Would you agree?
Yeah, absolutely. I mean, I think, we can use other similar terms, whether it's collaborator, convener, connector. I think that the role of communications now is truly, I think, at a point where we are hopefully going to be investing more in that discipline and skill set in ways that we would have never done before. So we've got our traditional comms, obviously, from an internal, external perspective. But I think, as we consider all the change management issues that are upon us, all of the solution, excuse me, all of the challenges that are out there to solve, having that clear, crisp, concise communication, and obviously coming from a team.
Yeah, that's so good. That's such a, I mean, it's so inspiring because there are times where it feels like a little bleak, right? It's so inspiring to know that this is our time, this is our place, and we're here together. And people like you working in the industry just make it that much, much more achievable for all of us. And that's why I really appreciate our collaboration and our conversations because we bring a lot to to the times, and that's great.
Yeah, no, I will say, I think that mindset mentality today, has to be we versus me, right? I think that on every level, I think that there is an inherent aspect of that can drive us forward together versus individually.
Yeah, I love that. I love that, Selima. Thank you so much for spending a few minutes with us. I really appreciate it.
A pleasure.